In this video, we're going to talk about shoulder blade squeezes and what's my beef with this exercise. Why do I rarely give this out? But before we get into this video, if you like videos about this topic or topics like this, make sure to like this video and subscribe here or at chaplinperformance.com/the rehab corner. Shoulder blade squeezes, right? Everyone's heard of these shoulder blade squeezes, and if you haven't, what we're talking about is basically, okay, you're sitting here and you're gonna retract your shoulder blades, you're gonna pull them back and try to bring them together in the back, right? So the inner part of that shoulder blade, the medial border, is going to go in towards the spine, okay? And you're gonna hold it there. And in that position, what muscles are we getting? Okay, so primarily in that position, because the arms are down, the shoulder is gonna be more likely to be in what's called a downwardly rotated position, or at least a neutral position. We're going to get rhomboids and middle trapezius, but in that position, we're going to favor the rhomboids a bit, okay? Just because of the nature of where those shoulder blades are going to sit. And if you have a pain situation with the shoulders, the likelihood of your shoulder blades resting in a relatively downwardly rotated position is a lot more than if you're kind of normal and they rest neutral between upward rotation and downward rotation. So if we give this exercise to someone who has pain and their shoulders are already in this downwardly rotated position, we're enhancing that because we're getting preferentially more rhomboid when our arms are down like this, because our shoulder blades follow suit with the arms and we're getting more rhomboid. And many of you are probably thinking, but isn't that good? Don't I need, strong rhomboids? And the truth of the matter is, you really don't. I've never met anyone with any weakness in the rhomboid. That's never been an issue for anyone that I've ever met. No clients, no patients. So I don't really think rhomboid weakness is an issue. And in fact, when I was reading Shirley Sarman's book, which is Diagnosis and Treatment of Movement Impairment Syndromes, it's one of the Bible level texts for the field of PT. I mean, she says she rarely ever has someone adduct, which is bring together, retract that scapula when their arms are in a downward position, because it does use more rhomboid, and it's going to use even more levator scapula, right, which is another downward rotator of the shoulder. So what are some other reasons I don't really like this? I don't really like this because if we're facilitating that downward rotation movement, right, because we're in a position where the rhomboids work better as retractors than the middle trapezius does, then we're potentially going to cause maybe more pain, more issues, because as we know, it's the deficit, the lack of upward rotation of the shoulder blade that causes most of the problems with pain that people have when they have shoulder issues. So when are we really getting that full upward rotation in the gym, right? Certainly not when we're doing rows down here, certainly not when we're doing flat pressing necessarily, maybe. But maybe overhead presses, probably not lat pull downs, maybe on the way up, but what we're going to find is there's going to be a tendency to overly downwardly rotate on the way down, right? And so it's not too much of a problem if you don't have pain and you can still get all the way up. Then shoulder blades squeeze away. But the typical people who try to do these shoulder blade squeezing exercises are people that have shoulder pain or people that are trying to improve their posture, right? And here's my big beef with this, right? When people do the shoulder blade squeeze, they'll do this, but what will come with it is the rib cage. And what they do there is they're extending, especially at the junction between their lumbar spine and their thoracic spine, they're also flattening out their thoracic spine. Now, we need our thoracic spine to have enough curve in it, and we don't want a lot of extension between where the thoracic spine starts from the lumbar spine, so the mid to low spine, that junction. We don't want a lot of extension there because there's a big muscle that rests right about at that level, the diaphragm, which we need to breathe properly to have proper chest wall movement, proper breathing, and proper nervous system balance, whether it's fight or flight, rest, digest. So we really don't want to be doing that so that we can get this, right? And so, okay, what are some practical tips? Well, if you're someone who you had some issue with the shoulder and you can't reach up to do a shoulder blade squeeze to get the middle trapezius in a position to work and the rhomboid disadvantaged to work positionally, then you can do something like this, where you fire up the upward rotators first, right? And the way we're going to do that is we're going to do a little bit of external rotation. So remember, when we were talking about external rotation, we said that our serratus anterior is going to help us do external rotation of the shoulder blade. Okay, and so if we use external rotation of the shoulder joint, we're going to get some external rotation of the shoulder blade as well. So what you're going to do is you're going to pull apart this way. It's going to give you some external rotation of the shoulder joint, and it's going to kind of feed into that external rotation of the shoulder blade via the serratus anterior, which you should be feeling on the rib cage. If you don't, you should go to the serratus video so that you can learn how to find that, right? And then from here, without moving the rib cage, so we're going to do our big exhale first, down and in with the ribs, there, then we can think about pinching together and slightly down, right, within that context. Okay, so now we're getting more middle trap, right? Probably less rhomboid because the serratus anterior is the direct reciprocal muscle to the rhomboid. Okay, so we're at least balancing it out a little bit. We're going to balance out how much rhomboid we get versus how much mid-trap. We're going to get some serratus in there. We're going to get some lateral rotators in there. The pecs aren't going to be able to work. The lats aren't going to be able to work. It's just going to be a beautiful thing all the way around. The other thing that you can do is you can slide your arms up the wall and then try to do your pinch there, but the same thing applies. So let's say I'm sliding up the wall here, and then I go to bring the shoulder blades together. If I keep my rib cage backwards, right, so that my shoulders are on a nice stable base, if I go to squeeze those together, they're not going to be able to move together that much, which is what we want, right? We don't want it to be this big thing. We don't want the shoulder blade moving more than it should, right? It should maybe come within an inch or so of the spine here. We don't need it right on top of the spine. We don't need them touching together, right? Some people use the cue of, squeezing an acorn or something, or squeezing a pencil between the shoulder blades, but I don't really like that because, at any joint, you can either have not enough motion, just the right amount of motion, or too much motion. And the shoulder blade and the rib cage, the scapulothoracic joint, there's no difference there. We want the right amount of upward rotation. You don't get bonus points if you have more upward rotation than you need. In fact, you might have more upward rotation because you either have an injury or the excessive upward rotation might even contribute to an injury, right? Probably less risk than not having enough upward rotation, but still, we don't want extra. You don't get extra points for being able to do splits. You're at an increased risk for injury, especially if you can do side splits. You're just asking for a groin pull. But anyways, that's a whole different video. But anyways, you want to put those arms in a position where they're overhead, right, to get upward rotation of the shoulder blade, and then do your retraction from there, do your shoulder blade squeezes from there. You can do it down on a table, so you can be here squeezing the shoulder blade in with your arm overhead. That's a great way to do it. If you do it that way, I would stack pillows, stay on top of the pillows, so that you can, again, promote this natural curve in the back, right? But honestly, you could even do it from here. You could even try to squeeze those shoulder blades from there. Exhale, curve up, and then try to squeeze from there. Then if you want to get the serratus a little bit extra, you can pull the hands apart, okay? Push down, pull the hands apart, right? Now we're getting external rotation of the shoulder blade as well as protraction of the shoulder blade to start. Once you get the serratus, you feel it, then you can do retraction, and you'll actually use that serratus a little bit eccentrically to control it as you're using the middle trap concentrically to bring it together, right? So the middle trap's shortening, serratus is lengthening, but it's being contracted as it does that. So that's a good way to control the retraction, right? So your shoulder blades just don't fall off the rib cage while you're doing it. That's a good way to work it. So try those out. That's it for today's video. Big takeaways are shoulder blade squeezes with the arms down without anything to cue us to get more upward rotation with the shoulder blade. Probably not the best thing in the world, not the best bang for the buck. You want to avoid the excessive extending of the back that can go along with that. And arms overhead or using some sort of external cueing to get you into a little bit more upper rotation with the shoulder blade before you go and try to move those shoulder blades together is probably going to be the best bang for your buck. So if you like this video, please like it right now and make sure to subscribe either here at chaplinperformance.com/the rehab corner. Until next time, I'm Greg Chaplin. Thanks a lot for watching and have a great day.